Hello everyone, my name is Michelle Battye and I am the Programme Manager of the European reference network called EUROGEN, which deals with rare urogenital diseases and complex conditions. I have no conflict of interest. I'm here to describe an example of the European reference networks to show you how we use a system called the Clinical Patient Management System to hold virtual consultations. We really use it to bring experts in rare diseases together virtually so that they can have clinical discussions about the most rare and most complex cases. It's a digital tool for these new e-consultations and it's compatible with computers, tablets and smartphones. There is a completely secure upload of the patient's medical information, and then there's exchange of pseudonymized patient data. So all after the patient has given his or her informed consent to share their data. And CPMS users, they're all healthcare professionals who work in one of our healthcare provider centre members. And really the system now means that the information, the medical information can travel rather than the patient. It's the advice which is being given from the network experts to the doctor treating the patient wherever the patient happens to live. So we know that because rare diseases are so fragmented, there are cases scattered all over the Europe and indeed the world. We know that some of them can't be diagnosed at national level. There simply aren't enough experts. So they can now be referred to the appropriate ERN. And the ERNs are really a system which sits above the national member states' healthcare systems and enable countries to access highly specialised advice where they don't have it in their country, perhaps because they have a very small population. The ERNs use CPMS to evaluate the cases and provide the highly specialised medical advice back to the clinician who's treating the patient at national level. And that's where all legal responsibility for the patient still remains, as it's always done, with the clinician treating the patient where they live. There's full involvement of the patient. The European Commission very helpfully helped us produce an informed consent for the patients for use across all the ERNs. And the consent form can also consent patients if they want to be part of research projects and also for their data to be included in the 24 ERN registries. The outcome of the cross-border virtual case discussion is usually discussed with the patient by the clinician treating them. So what's been achieved? Well, since they began in 2017, the ERNs have considered more than 2,000 cases. And now a fantastic result is that we have 2,500 experts registered in the ERN system. CPMS is being constantly improved to make these virtual consultations easier, faster and more convenient for the experts using them. And this is just a slide to show you that most of the panels that have been created by our particular ERN were a success. So advice was sent about the patient, the particular rare disease or complex case. We have identified some challenges with the completely new system that operates across all countries in Europe. Expert discussions are best done by video meetings so that they can look at the scans, the medical information and discuss it. It's often very difficult to get the experts together though at the same time. So we really do rely on a huge amount of goodwill from them, and they often do this late in the evening after they've finished all their clinical work. Some experts struggle a bit with the technology, but they manage to overcome this by having trainees in their department who are prepared to do this for them. That's really nice to see. And it can be difficult for clinicians to get used to how the new system works. So by making it easier to use, we hope to increase uptake in the future. So most ERNs provide as much support as they can to their clinicians using CPMS. We do this on a one-to-one basis. We provide specially tailored manuals with hopefully clear instructions on how to do things. We have video tutorials, and there's also a newsletter that we produce to tell people tips and tricks and how the system's changing. Next slide, please. And we're really excited because after the enlargement of the ERNs, most ERNs are doubling in size. So there's an increasing number of experts available to join in the virtual MDTs. The simplification of the system is coming, and we hope that that will make it more user-friendly. And there's an exciting pilot reimbursement. The Commission is allowing the reference networks to reimburse healthcare providers small amounts for some of the time that their experts spend giving this expert advice. And that's a really welcome new development. And new software to make the whole system work better is under development. And it's been really interesting to see this new tool that the Commission has put at the disposal of the ERNs, which is we're really just beginning to get to grips with. We've managed to reuse it in the light of other circumstances. So, for example, CPMS was used in the COVID crisis, for example, when doctors in other countries needed to talk to other doctors about how they were treating the COVID patients, particularly in the early days where very little was known. We're also using the CPMS system again to try and advertise that we have all our doctors and experts are available to give advice to doctors in the Ukraine about patients with rare diseases. And we're also very much trying to support all the border hospitals, all the members of our network in Poland and other countries who are really dealing with the coal face of all these patients, refugees arriving, some of whom have rare diseases. The cancer networks in particular have been very active, and they've managed to arrange the transfer of at least 400 paediatric patients with cancer out of the Ukraine and shared out across the healthcare providers, some of them in the network who can take on the care of those children who very desperately need specialist attention. So it's really nice to see the way CPMS has been used for different purposes very quickly to respond to challenges that none of us could have thought about 10 years ago, or even 5 years ago. So I think, again, that's a really interesting evidence of how the ERN system is able to directly help patients, other healthcare professionals, and really make a difference across Europe. And that's the end of my presentation. Please, if anyone is interested in the ERNs, feel free to contact any of them via their websites.